Complications of the flu would include, so first of all, I should mention that with complications, these occur because with the flu basically damages the body's ability to fight off infections. So after getting infected, you then now become at risk for more infections of the airway, such as an ear infection, sinus infections. You may even develop a pneumonia, which is an infection of the lung, as a result of getting the flu. So treatment is what we call supportive. We treat symptoms. So if the patient presents with a fever, we give anti-fever medications. If they're coughing heavily, we can give cough syrups. If it is that the person is presenting with a flu and we're concerned that they may get complications, so these persons would include young children or elderly patients over 65, we can offer what we call antiviral agents. This is rarely done and it's only reserved for those who are at serious risk for complications. Otherwise, simple anti-fever medication, some Panadol and some DPH. Not to mention rest and hydration. For the common cold, there is no actual preventative measure out there. What we do encourage patients to do is hand washing to prevent any form of bacteria or spread of the germ. We also recommend patients to cover the mouth when they're coughing. For the flu in particular, we actually have a vaccine, and this vaccine is recommended to be given every year and can be obtained from the Ministry of Health every year, usually around the winter season, which is from September to about January. But just to say, at any point during the year, the government will have access to it. You can always visit the Morosco Road Ministry of Health Department here in Kingston for further information. So that is the prevention aim for the influenza, which is the vaccine. I should also note that because there are various strains of influenza, meaning there are different types, the vaccine doesn't prevent against all types, but it does offer more protection as opposed to not being vaccinated. So if you can, ensure to be vaccinated every year.